Hello friends, this is Dr. Avinash Borade, ENT Surgeon practicing in Navi Mumbai. Today we are going to discuss a very interesting and common topic called vertigo. Basically, a lot of patients are suffering from this problem. So it is very disturbing and it is making patients to say take rest or take leave from the job, and the patient when comes to our clinic, patient is quite disturbed and suffering from vertigo. So, what are the different types of vertigo? There are mainly two types. It's called peripheral vertigo and central vertigo. As the name suggests, central vertigo means it is related to the central nervous system, or the cause is in the brain. Peripheral vertigo is related to peripheral balance system. That means there is some problem in the inner ear or other parts of the body which are contributing to the balance of the patient. So, common causes of vertigo are in peripheral vertigo. We generally say the most common cause is benign paroxysmal positional vertigo, which is called BPPV. Then there is Meniere's disease, which is a problem in the inner ear. Then there are some infective causes like vestibulitis, labyrinthitis. Then even migraine can give rise to vertigo. It is called migraine associated vertigo. Then in central nervous system, there are very common causes like stroke, which can mimic as a vertigo episode, but the cause is because of some damage to the central nervous system. Then there are some effect of medications can also give rise to vertigo, and other common cause is the trauma. If there is damage or trauma because of some accidental injury to the brain or even to the neck and the inner ear, then vertigo can be very much persistent. Then some drugs abuse like alcohol or other drug abuse can also give rise to symptoms like vertigo. So, we will see what are the most common symptoms of the vertigo. So, when patient comes in the OPD, symptoms varies from very mild dizziness or imbalance to very severe vertigo in which patient cannot sit or even get up from the bed. Other associated symptoms are nausea, vomiting, sweating, sometimes loose motions also. And when patient tries to get up from the bed, there is again the episode starts, or suddenly there is a rotational movement of the surrounding, which is a typical vertigo. And patient has to take medicines and take rest for that. Many times we need admissions for severe vertigo episodes which are associated with severe projectile vomitings, and patient cannot wake up from the bed. So, when patient, any person or patient comes to the doctor's clinic or hospital, we evaluate the patient. So, for evaluation we first take a detailed history. The duration of the vertigo is important. The type of vertigo, is it a proper rotational movement or imbalance, is important. Then other medical history, like does a person has hypertension, diabetes, cholesterol, any heart related issues, any previous history of similar complaints, or any previous history of major illness is very important. Then we also take history in terms of what medications they are taking, what chronic illnesses they are having. Then important thing is examination. As a ENT consultant, we always see ENT examination, because many times inner ear diseases are the common cause. So, peripheral vertigo is way more common than the central vertigo. So, we examine the ear by otoscopic examination or otoendoscopic examination. We also check for the history of hearing or history of tinnitus. Tinnitus is a constant humming or ringing sound in the ears. This is very indicative of a specific inner ear dysfunction or inner ear damage. So, the next step is we evaluate for audiological evaluation by doing audiogram and impedance. Then there are some positional tests. If a history and symptoms suggest of a positional vertigo, then we do some clinical examination tests which are called positional manuals, and accordingly we decide the treatment. Then we will try to rule out, if a history suggests, we will try to rule out a central nervous system cause by doing a clinical examination, some tests, and if necessary a MRI also. There are specific tests for vertigo again, which are called video nystagmography or electrocochleography. So according to the audiology report and history, we decide which test to be further done. Then once we reach a particular diagnosis, then comes the treatment. So many vertigo cases are not very severe, they are mild, and medications give a lot of relief to the patient. Medications in form of beta histine or cynarazines and antiemetics has to be given. So a course of say 5 days to 10 days is most of the times given, and patient gets significant relief from the medications. Few specific problems like positional vertigos require repositioning maneuvers. So according to the diagnosis which canal is involved in the inner ear, we decide a positional maneuvers. So there are different positional maneuvers for different posterior canal wall BPPV, the maneuver is different. So anterior and superior canal wall is different. So that is positional maneuver is one form of treatment. Then we ask patient to take rest at least for 2 to 3 days if the symptoms are very severe. Then we have to evaluate the other cause or underlying causes of the vertigo and treat it accordingly. So many times the cervical spondylosis is the cause of vertigo, sometimes Meniere's disease is the cause. So we have to treat the underlying disease itself, otherwise just giving medications might not help in long term, symptoms will recur again. So we have to treat underlying cause according to the diagnosis. Then there are some lifestyle modifications or lifestyle changes we advise patients to do. In most of the cases we advise not to do very rapid or sudden movements of the neck and the body. If a person is sitting or lying down, he should not get up very fast. So faster movements of the body and neck should be avoided. If a patient is having a problem with the neck, then we advise them to use a neck collars also to restrict the movement of the neck. Then patient should take a proper sleep. Rest is very important because lack of sleep is also a very common cause of positional vertigo. Patient should avoid excessive traveling on a bumpy road. Then they should manage their stress levels also, because migraine is very common cause. We call it as almost the second most common cause of vertigo. Then it is directly related to the emotional physical stress. So all these things patient has to manage, plus maintain a healthy lifestyle. Regular exercises are required, proper diet and healthy diet is also required. If any person is suffering from imbalance, rotational movement of the surrounding, or he is not able to walk properly, or there is a sudden movement of the surrounding, or himself he is feeling some dizziness or lightheadedness, please you can feel free to contact your doctor. We here at Borade ENT clinic deal with the vertigo problems very regularly. There is a proper evaluation system we have, and we can treat this problem very carefully. Thank you.